Welcome back. Today we talk about how to lower SAR in clinical practice. If you are an MRI technologist or MRI scanner operator, you may have seen the message, SAR limit exceeded, pop up during an MRI scan. This warning can stop you from proceeding and may interrupt your workflow right at the scanner console. So what does it actually mean? Before any scan actually starts, the MRI system performs what is called SAR look-ahead calculation. Prior to each measurement, the system calculates the expected SAR values, always assuming a worst-case scenario, and compares them with established safety limits. This SAR look-ahead calculation requires two key pieces of information. 1. The total measurement time. 2. The total RF energy applied during the measurement, including all repetitions. Using these inputs, the system predicts whether the scan will stay within safe SAR limits. If any of the calculated SAR values exceed the allowed threshold, the scan cannot be started. That's when you will see the SAR limit exceeded message pop up in a dialog window. This is not just a technical warning, it is a patient safety protection mechanism built into the MRI system. So what should you do when this happens? First, do not ignore it. The system is preventing you from running a sequence that may cause excessive tissue heating. Next, you need to reduce SAR by adjusting your protocol. So when do SAR limits actually get exceeded? SAR limits are exceeded when an MRI sequence deposits more RF energy than the scanner allows under the selected safety mode. In the SAR physics video, we introduced the key factors that influence SAR in MRI. And as you've learned, SAR is not controlled by a single parameter. It results from multiple interacting factors. Scanner hardware and system design set the baseline, but in daily clinical practice, it's really the sequence design and imaging parameters that drive SAR the most. At the same time, patient positioning and body geometry play a major role. They influence how RF energy is distributed throughout the body, which means SAR is not uniform. On top of that, environmental and situational factors can further modify RF deposition. So what are the main reasons SAR limits get exceeded? RF-intensive sequences, such as balanced SSFP, which use rapid and repeated RF pulses, high flip angles, which directly increase RF power deposition, strict safety modes, where normal mode applies more conservative SAR limits compared to higher operating modes, cumulative RF heating over time, meaning SAR depends on the total energy delivered, not just individual RF pulses. Here's the bottom line. SAR is a complex, spatially varying phenomenon. It goes far beyond a single number displayed on the scanner. SAR limits are exceeded when your scan parameters collectively produce more RF energy than is allowed for patient safety. When do we need to adjust SAR for MRI safety? In practice, SAR adjustment is required whenever the scanner's standard assumptions about RF energy deposition and heat dissipation no longer accurately reflect patient-specific risk. Clinical SAR limits are based on population averages, but real patients vary widely in body composition, thermoregulation, implant properties, positioning, and sequence-dependent RF exposure. Because of this, SAR management is not optional. It is a context-driven safety optimization process. For example, patient-related factors often necessitate adjustment. Implants can significantly increase local RF energy deposition by concentrating electromagnetic fields, a risk that is not captured by reported whole-body SAR values. Even in otherwise healthy patients, SAR risk may rise due to technical and procedural factors such as sequence design, coil selection, scan parameters, and workflow decisions. The goal of SAR optimization in MRI is simple: to maximize diagnostic efficiency while keeping RF power deposition safely within established limits. To achieve this, we must think beyond individual parameters and adopt a big-picture strategy that spans sequence design, parameter adjustment, workflow planning, and hardware optimization. SAR management begins at the pulse sequence level, where different sequences inherently deposit different amounts of RF energy. Next, we adjust the math of the sequence. Since SAR is directly related to RF pulse amplitude, duration, and repetition, modifying parameters such as flip angle, TR, or echo train length can significantly reduce RF energy deposition. These adjustments provide immediate and predictable SAR reductions, making them one of the most effective tools in clinical practice. Modern acceleration techniques go beyond simply reducing scan time. By decreasing the number of phase encoding steps, they reduce the total number of RF pulses required. Fewer RF pulses translate directly into lower cumulative energy deposition, making acceleration both a speed and safety strategy. How the exam is planned matters as much as the sequence itself. Smart scanning requires careful consideration of coverage and workflow to ensure efficiency without unnecessary energy deposition. Finally, hardware and system optimization serve as the final safeguard. Optimization also depends on the physical setup and system inputs. Using dedicated local coils such as head or knee coils improves RF transmission efficiency. Accurate patient data entry is also essential, and understanding the scanner's operating modes is critical for maintaining safety while optimizing performance. In this section, I summarize the 3+3+3 rule for SAR and MRI practice. This framework connects SAR reduction, image quality, and MRI physics into a simple clinical guide. First, 3 principles to reduce MRI SAR. SAR is mainly driven by RF power, which depends on factors like field strength, flip angle, and duty cycle. To reduce SAR, we lower RF power by reducing flip angle, using refocusing pulses below 180 degrees, or switching to lower SAR sequences like GRE. We also reduce duty cycle by increasing TR, reducing slices, shortening echo train length, and using variable flip angle techniques. Finally, scan efficiency can be improved using acceleration methods like parallel imaging and partial Fourier to reduce total RF events. Second, 3 core image quality factors: image contrast, signal-to-noise ratio, and spatial resolution. These depend on parameters such as TR, TE, matrix size, slice thickness, and field strength, and they always trade off with SAR. Third, the 3 MRI magnetic fields with a focus on safety are: B0, the main static field, which is always on and poses projectile and implant displacement risks; B1, the RF field, which is the primary source of SAR and can cause tissue heating and implant-related heating; and the gradient fields, which are responsible for spatial encoding but can induce peripheral nerve stimulation due to rapidly switching magnetic fields. Together, these 3 layers provide a practical way to understand and control SAR in clinical MRI. For instance, for a given patient at 1.5T using fixed coils and the same protocols, 3 principles to reduce MRI SAR might be the major framework to work with. In this section, I have listed the key parameters you need to consider. The SAR equation summarizes a combination of sequence design, patient characteristics, and hardware configuration. Among these, several relationships are especially important for practical optimization. From a sequence design perspective, SAR is strongly influenced by RF pulse parameters. In particular, SAR scales with the square of the flip angle, meaning that even modest reductions in flip angle can lead to a substantial decrease in RF power deposition. In addition, sequence timing plays a key role. Short TR values and frequent refocusing pulses increase RF duty cycle, which directly elevates SAR. From a patient-related perspective, SAR is not constant across individuals. It increases significantly with body size, since larger patients have greater tissue volume and altered electromagnetic field interactions. Tissue properties also matter, including conductivity and permittivity, which affect how RF energy is absorbed and distributed within the body. From a hardware perspective, field strength and coil configuration further shape SAR behavior. Higher field strengths generally increase RF energy requirements, while coil design influences RF efficiency and spatial distribution of the B1 field, both of which affect local and whole-body SAR. Together, these factors form the practical framework for SAR optimization in MRI, linking sequence parameters, patient variability, and system hardware into a unified safety consideration. All right, let's move into a clinical scenario focused on protocol optimization under MRI safety constraints and SAR limitations. In this case, we have a 7-year-old male patient referred for a neuro-MRI examination. The patient has bilateral cochlear nucleus CI512 cochlear implant systems implanted on both sides. According to the MRI safety documentation, the device is MRI conditional with specific scan conditions and a strict SAR limitation of less than 1 watt per kilogram. These constraints must be carefully respected to avoid device heating, malfunction, or patient injury. The examination is planned using the system's main body transmit coil in combination with a dedicated local head receive coil. While this configuration is standard for neuroimaging, It also means that RF energy deposition must be tightly controlled at the sequence level. Therefore, the clinical request is to modify and optimize the MRI protocol to ensure compliance with both the device's MRI conditional requirements and the SAR threshold of less than 1 watt per kilogram. To approach this systematically, the neuro-MRI protocol should first be evaluated at the protocol level. Key questions include: what is the study purpose? How many sequences are included in the protocol? And where are the implants located relative to the field of view, inside or outside the imaging volume? These factors define the overall risk context and help determine how strict SAR control needs to be. Next, for each individual pulse sequence, a deeper layer of analysis is required. We need to consider how many RF pulses are being applied throughout the sequence, how long the sequence runs in total, and how much anatomical coverage it includes. Longer scan durations, larger coverage, and higher RF pulse density all contribute to increased SAR, so these parameters directly influence optimization decisions. Finally, at the RF pulse level, we need to understand the detailed physics of energy deposition. For each RF pulse, we should ask, what is its function, whether it is excitation or refocusing? What is the shape of the pulse, such as sync or Gaussian? What is its amplitude and duration? And most importantly, what flip angle does it produce? Since SAR is strongly dependent on flip angle and pulse characteristics, even small adjustments at this level can significantly reduce total RF power deposition. By systematically analyzing the protocol, sequence, and RF pulse levels together, we can identify where SAR is being generated and apply targeted modifications without compromising diagnostic quality. Here is the optimized MRI protocol, along with the corresponding safety and imaging metrics, including SAR, B1 plus RMS, SED, specific energy dose, and acquisition times, as well as representative image results. After protocol optimization, all sequences were adjusted to remain within the MRI conditional safety constraints, with SAR maintained below the required threshold. Despite these safety-driven modifications, the overall diagnostic quality of the examination was preserved. The neuroimaging sequences still provided adequate anatomical detail for clinical interpretation. This case demonstrates that, through systematic protocol-level optimization, it is possible to achieve a safe balance between image quality and RF energy deposition. The examination was completed successfully, fully compliant with MRI safety requirements, and without exceeding device-specific SAR limits. I've listed a few questions here to test your understanding. These questions are designed to help you reflect on what you've learned throughout this section and reinforce the key concepts related to MRI protocol optimization and SAR management. Take a moment to think through each question carefully before checking the answers. Answers C, B, B, D. Thanks for watching. If you found this video helpful, please like, save, and subscribe for more content like this.